Welcome back to Recharge. Dr. Gene Shirakarad here with Dr.
Corey Howe.
That's you.
That's me.
Let's talk about our ribs. These ribs,
Yeah.
not delicious kind of ribs we eat, which
Although, you can go for some ribs.
could always go for some ribs.
Mhm.
Ribs are very, very important for golf and the golf swing. Obviously, the entire body is. But when we're talking about a golf swing, particularly the rotation piece of it, and when most people think about mobility, they think about the upper back or their
Yeah.
spine and spine mobility. But ribs are incredibly important for that.
What's interesting about ribs that I think a lot of people probably don't know or take for granted, they each attach to the spine.
Right.
So when we're talking about thoracic mobility, there's a ton of costovertebral joints or rib to spine joints that could be playing a factor in someone's pain or performance.
Yeah, absolutely. And that's the critical piece. We have two P's on opposite ends of the spectrum, the pain and performance spectrum. So when we're working with golfers, that's kind of one of the first questions we ask is, are you coming to us because you need to get out of pain or because you need to head towards performance? And they're very different. Yeah, there's some overlap, but we really want to know, are we trying to get you out of pain or are we trying to improve a performance piece, which is what kind of looking at exercise and training
And
is about.
those three categories that we look at: strength, power, and mobility. That would be more of that performance
Performance
side.
piece of it.
Yeah.
Exactly. When you're in pain, your body does what is called inhibition, where it naturally kind of lowers the barrier of what is capable, not because it turns things off or not
Mhm.
because you can't, but because your brain says you probably shouldn't because of danger. So pain is just danger in your body. So for us, when we're working with golfers, it's one of the first things we do when somebody's in pain is say, here's what you want to get back to. You want to play golf. What can we do to help your system process these sensations as best we can in order to allow you to do something like golf? And when you're dealing with pain in the rib cage, that that can be fairly complex, but it also can be pretty simple because rib pain hurts so much. In fact, oftentimes people go to the emergency room thinking they're having a heart attack, but it's actually rib pain or the joints around the ribs. So it's very, very intense pain. And in this video, we're going to show you some things to do if you're in pain and if you want a little bit more mobility, if you feel like your rib cage is stiff in the golf swing, we'll show you some performance pieces as well. So we'll give you a full cut of that spectrum. Pain piece, we'll show you an exercise you can do to help with the pain. And if you want to get a little bit more rotation from your rib cage, we'll show you an exercise in that. We're going to eat any ribs?
Maybe later.
Okay, maybe later, but you won't see that. So let's get into it. Corey's down here, sideline. Now, let's say you have rib pain, and what we're kind of looking at is unilateral or one-sided rib pain, which is the most common. It's very uncommon to have rib pain on both sides. The disclaimer to make again, if you're having intense, sharp pain around the rib cage, especially on the left side, rule out something very serious, heart attack, things like that, especially if there's a referral pain on the arm. But let's say you have everything ruled out and you saw your primary or your medical team, and then you know it's musculoskeletal based. This is kind of the approach for that. So you're going to lie down on the side of the rib that is hurting. So in this case, it would be left-sided ribs. A lot of times just putting that compression on the side of the rib will feel better already because the ribs is they wrap around from front to back. And like Corey was saying earlier, the wraparound in the back goes into your vertebrae. So when you press on the side, there's this kind of squish effect from the front and the back.
You've probably seen in movies when somebody breaks a rib, they'll wrap them in an ace bandage around their torso. And
Yep.
that's kind of doing the same thing, adding a little bit of compression, a little bit of sensation of stability.
Exactly.
And,
Exactly. That little compressive force feels
Yeah.
pretty good.
Yeah.
So the first thing you're going to do is you're going to lie down on your side, again, the side that is hurting down on the ground, and you're going to take a deep breath. So take a deep breath, ideally through your belly, and that's going to force the rib cage out further and it's going to push it into the ground. So do a few breaths and see if just that breath work takes that pain down a notch, which for most of you it will. Then those breaths should kind of start to highlight where in the rib cage the joint is. So it kind of spotlights for your brain the area of discomfort. Once you kind of feel that, you're going to take your right hand or whatever side you're on, and you're going to wrap it around like Corey's doing and grab underneath. So you could grab a hold of it. And you're going to grab it and you're going to hold on to that. Then from there, you're going to take a deep breath again, see if you're kind of on it. And then as you breathe out, you're focusing on the shoulder coming back and then back again. Now, as you're doing these, you're going to do small rotations back. You're holding on the whole time. Your hand is not letting go of that rib angle. You're taking a breath, you're breathing out, and you're going back again. And you go little by little, you do more and more and more until you rotate back. They should feel pretty good. The intensity should go down and down as you do more and more of these. You might hear or feel a little pop. That's just kind of the joint releasing a little bit. That's okay. Again, you should not keep doing these if intensity of pain goes up.
What's interesting with this is even though my hand is on the rib angle or this kind of the side of my body, when I rotate, I feel a little pulling or something into my back. And that's where the ribs come in and attach to the thoracic vertebrae there. So you can really actually feel the mobilization occurring.
Yep. These feel great, especially if you're in a lot of pain with the ribs. This can be a lifesaver, help you out a lot, especially if you have an outing coming up. If you have that tee time, you got to be there. Not above lying down on the first tee box doing that.
And if you have to do it on the ninth hole too, nobody's going to judge you.
Yeah, they'll just join in with you. Try it out, see what you think. Let's talk about performance.
So let's look at the other end of the spectrum, the other P in this scenario, the performance side.
Fun side.
The fun side, the less painful side.
The less
that's
painful.
for sure.
Well,
and even though we're saying performance, let's say we're working with somebody in pain, it ends up being a spectrum anyway, right? We'll take that person that is having some rib pain, and over time we'll progress them into more performance type of scenario. Yep. That's what we're going to look at here. Some rib cage performance for the golf swing. Like we said earlier, we need the rib cage where the ribs attached to the spine, and even on the front side, we need everything to move well in a golf swing to be able to have as much range of motion and provide as much of a possibility for hitting a good golf swing. So we're going to do that here using this block again, like we did earlier with my feet. However, now it's going to block Gene's hips. So the block is to his right side. That is his trail leg in a golf swing scenario. He's going to take the golf club and put it behind his back, just like so. Cool. So we're going to do two things in this half kneeling position, working on rib cage and spinal mobility. The first thing that we're going to do with the club here is it's kind of locking down, if you will, the lower part of the rib cage and where it connects to the spine, and allowing a little bit freer movement up top. So if Gene rotates to the right, you can kind of see the club angles down as well. Great representation of what happens in a backswing. We don't just rotate, we kind of rotate back and angle down. Yeah, where do you feel that?
My soul. No, I mean, it's very, very similar to, like, not just what I feel, but what I try to feel in my backswing. Like that is as close as it comes to when I have a good setup. You know, like when you bring your backswing back and you're like in your head in that split second, this feels right. That
very, very rarely do I see that.
Very rarely, but when it does, that's the tension I want to feel.
Yeah,
when I do it,
because tension in the golf swing, we want to be loose, but tension is what creates torque and power in the golf swing as well.
Yeah.
So this coiling aspect that we're getting at, the greater the coil, the more power we can generate.
Yeah, and for a lot of people, it's the lack of that rib motion forces you to compensate in other places, like the low back or with the shoulders. Like if you have a hard time keeping a straight leading arm, that's a lot of times because you can't bring your trunk back, but you still need to create that torque and generate some force somehow. So you bend that elbow and do a little bit of casting with it. So this is a good way to kind of build, and this is why it's more in that performance spectrum than pain, because it just helps you reproduce your swing and play a little bit better.
Sure. So then we can take the golf club and put it above our head. So now with the club above his head, what he's really doing, and you guys can't see it on Gene, these muscles up here are contracting, bringing the shoulder blades back. Um, and the idea is it's essentially kind of locking down that part, so the upper part of his rib cage and thoracic spine. So now he might feel it a little bit lower down the back.
Yeah,
So even though the club's higher, he might feel it a little bit lower.
yeah, it's tough. That is very tough.
Do you feel a difference between the two range of motion wise?
Yeah, this feels a lot more restricted.
Yeah.
Yeah. So this could be just a me thing, right? Where I have a little bit more capacity the other way around. But
Hmm.
this is really, really, really tough.
Sure. But also, we know as we move down the spine, the lumbar spine is really good at forward and back
Yeah.
motion rather than the rotation component. But so we're not quite getting down into the lumbar part,
Yeah.
but somewhere in between. Um, Really, really good for isolating the area that you're trying to target for the ribs and the thoracic spine there.
Yeah. Ideally, you put your body in a position for an ideal golf swing before picking up a golf club, right? Like that's where this golf performance piece comes into it. It's we're not necessarily saying that you need super high capacity in your body to play golf. We know that's not true. Anybody can play golf. But what this allows you to do is develop a range and capability to reproduce a golf swing to generate more force by using and doing less work. I think that's kind of where we come into the performance piece of things,
Yeah. Um, Doing less to get more done is always a good thing.
especially in golf when you have so many swings in a round, or if you're playing multiple rounds in a week or a weekend. Then that's tough to ask. So you want to put your body in the best possible position to do it over and over and over again.
Right.
Should you be so lucky? All right, that's our P to P spectrum. That just sounds funny.
It's funny.
That sounds funny. If you're enjoying that, go ahead and subscribe. We got a lot more content coming, talking about performance and pain. That's been a lot of questions that we've gotten about pain and golfing. So obviously, being able to golf is a biggie, right? So for most people, not even able to play well, just
Yeah.
to be able to play is important.
Yeah, and getting somebody out of pain can often in turn help their performance too.
Yeah.
So it doesn't always have to be one or the other.
Absolutely. So we got a lot more of that coming for you with our golf content. So make sure you subscribe and follow along. We'll catch you again on the next video from Recharge.